Um, I want to know, how does COVID kill people?
Yeah, thanks for the question, Grayson. As you all know, COVID has been sort of incredibly changing for all of us. And the good news is here, I'll give us some good news. The good news is that it hasn't affected kids as badly, right? Kids have done pretty well in the midst of this pandemic. And, for kids, COVID is a lot like a cold and sometimes a bad cold, and you can get a fever and cough and runny nose. But Grayson, as you state, COVID, as we know, has harmed a lot of our neighbors, has killed a lot of our neighbors, and particularly our elders. So how does coronavirus work? It's a virus, which means it's a germ, and its job is to attach to human cells and force our bodies to replicate the virus. So it uses our bodies as a machine to recreate itself. And what we're seeing in particular for when it harms people or kills people is that when it affects the lungs really bad, it can cause the lungs to swell up, get quite injured, leak fluid, and that causes people a really tough time to breathe. And that's why we're seeing so many of our neighbors and our elders in particular get really ill from coronavirus, because this virus really has liked to attack the lungs. Does that help answer your question, Grayson?
Yes.
Okay, thank you for the great question. So we have a number of great questions here. Gia, do you have a question for us?
Yeah, so my school at the beginning of the year used the hybrid learning style. And a couple weeks ago, we started doing fully online. And then after winter break, we're gonna slowly go back to hybrid. And I was wondering if there's gonna be a surge in 2021.
Oh, it's a great question, Gia. So one of the reasons why, what school districts are looking at is they're really looking at the number of cases per 1,000 people in our community. And so they'll look at a county like Hennepin County or our St. Paul neighbors, Ramsey County, and they'll say, how many people out of 1,000 are having this illness? And if it's above 50, a lot of schools are going to distant learning. And so what we saw with this current surge that we're in is that the numbers went really high and schools started to say, you know what, we're going to go to distance. So Gia, what I would be looking at, and what I think your school districts are going to be looking at, is what is that number come January? And they'll make their decisions based on that. And I think they're looking at those numbers every week. And they'll make decisions based on that. So, it is possible, unfortunately, that those numbers could go up and could come back down and go back up again. So one of the jobs of the health people is to look at that number really carefully. And if it's getting high, they may decide once again to make school either more hybrid or even more remote. All of our jobs is to sort of do our best to keep the virus down, keep distant, use our masks, wash hands, and then watch that number really carefully to see whether we can go back to in-person school. Is that helpful, Gia? Jane, you had a question as well.
Yeah, I wanted to know if there were any treatments for people with COVID to decrease the risk of having to end up in the hospital.
Yeah, great question. There's a number of medicines and treatments that have been developed. It's a little bit different than back in March and April. There are more treatments or more things we can do. So there's one medicine that helps to actually attack the virus itself, and that's been approved, and we're using that in certain patients. There's one medicine that helps to prevent serious consequences of COVID, and that's being started right now. We're starting to send that out. It is actually giving people antibodies to the virus. And then one medicine that we're using for people who are fairly ill, who are experiencing symptoms, we'll use a steroid medicine. You guys may have heard of steroids for other treatments. They're using a steroid medicine to help treat patients who are quite ill. And then in addition to all of that, we're providing patients oxygen. We're providing patients breathing support if needed to help them through the process. So I think, Grayson, did you have any other questions for me right now?
I'm wondering when will I get to have sleepovers with my friends again?
Yeah, thanks, Grayson. It has been really hard. A lot of the things we really love to do, we've had to put to the side during this COVID time, and sleepovers is one of them. So you all probably have heard that we have a vaccine in the works, right? And it's going to be hopefully approved here very soon, and we'll start to be able to give it to people. So I think there's two things that we can do, right? One, we can help protect people by giving them that vaccine, building up people's immunity. And then the other thing that we can do is try to keep the virus levels super low. In terms of sleepovers, it might be a little bit longer, Grayson, to be honest. I think we're going to wait probably till more people have that immunity after getting the vaccine. And we're going to wait to see that the numbers of viruses we have in our neighborhoods and our communities goes down. They're thinking that it'll take a good part of 2021 to get people through and get the vaccines. But I do think that I'm hopeful that the end of 2021, 2022 time, when we have the virus level much lower than it is now, and we have a lot more people being protected with the vaccine, that's a time that we're going to say we can resume sleepovers. And we're in a lot better place than we were not that long ago, in the sense that we have that light at the end of the tunnel. We're going towards that point. And I know that's not the answer you might want to hear. Probably can't do it next week. But it is out there, and I think we're going to get there.
Okay, thank you.
Yeah, no, thank you, Grayson. So, Gia, you had a question about the vaccines themselves.
Yeah, so I heard that the vaccine won't be distributed to youth, and I want to know why.
That's a great question, and it's something as a pediatrician I've been looking at a lot, right? Like, when can we get it to kids as well? So when they did this, so every medicine that's created has to go through a bunch of studies. You have to make sure they're safe, that they're not causing a bad problem, and then make sure that they actually work, right? You don't want to take something that doesn't work. What we're hearing about right now in terms of the vaccines, they've gone through that process. They're going through that process, I should say, and they've been trialed. But the problem is all the trials they've done have been on 16 and above. Folks 16 and above, and really adults is where they've been focused. So right now, Gia, all the data looks like some of these vaccines are safe in adults and they're effective in adults. The question then becomes, are they safe and effective for kids? And the good news is, Gia, they're starting those trials. They're starting that process now. It'll take probably, and I can't predict exactly, but let's say a year. It'll take some time, but it'll eventually, we'll say that this can definitely be safely given to kids, and hopefully we can say it'll be effective. And so we'll wait till those results, but I do imagine sometime in 2021 and 2022, we will be able to give vaccines to kids, effective and safe ones. But we need to study that and make sure. We don't want to give our kids anything that's not safe. So Jane, you had a great question about the virus itself. What was your question?
I wanted to know if COVID itself has mutated, like since it came around. Like, why are people getting it more than once now?
Uh, this is a great, interesting, and challenging question, Jane. It's actually something that's really evolving every day. So we do know that every virus, like the cold that you get, flu, COVID, does change a little bit. It has small mutations. So, if I asked you to copy a note that your friend wrote, there might be small differences. And that's what a virus does. It sort of copies itself over and over again. And every time there's going to be small little differences. And we're seeing that in COVID as well. Now, COVID has done a pretty good job of replicating itself identically, but there's small changes, and we have seen a few of those. The truth of the matter is, Jane, this virus is new to all people. So whether there's a change or not, it's going to affect us, unfortunately, until we get that vaccine. So what we've seen with COVID is that there have been small changes, but nothing that would really change the way it has affected people yet. Now, why can people get it? Again, this is active research, so scientists are actually trying to figure this out. One of the things is they suspect that your immunity after you get the illness may go down a little bit with time. For example, some of the viruses we get, you can get it, and then your immunity goes down a little bit over a course of months or years, and you can get that similar kind of cold again. That may be what we're seeing. And we might be seeing small mutations that cause COVID to be able to affect a person again. Either way, what we have seen, though, is people's bodies being able to respond a second time a little bit better. And I do want to assure you too, Jane, we're not seeing a lot of people who have been affected and then affected again with a second strain. We're seeing most people getting it at this point once with one particular strain. So there are small mutations. It is possible to get it again, but luckily on a second time, people have done pretty well. Next question we have, I have Grayson. You had a question about the vaccine as well.
Will people be able to buy the vaccine?
So here's a little bit of good news, Grace, and I feel like I've told you that we can't have sleepovers for a little bit, and I've given you bad news about this virus. Here's a little bit of good news. The vaccine, as of right now, the information that we have will be given to people in this country. So you actually don't have to buy it. The hope is that it will be actually given to you, to an adult for free. And hopefully the same thing will apply when kids are able to get the vaccine as well. So that's really good news, is that the hope is that the American government will be getting it out to everybody at no charge to individual people. So a little bit of good news. And then I have Gia. You had a question about what the future might look like.
Yeah. Will we still be having to mask and social distance through 2021?
Yeah. Unfortunately, I think the answer is largely yes. I know we would love to walk, into our school without masks and not social distance, and that would be a really lovely thing. And I think that day is coming. Okay. I just don't know that it'll be in 2021, or at least not in early 2021. Why? Because it's going to take some time, even though we have vaccines and vaccines are coming out, it's going to take quite a bit of time, at least on the order of months, for us to be able to get that to everyone. And until we can make sure that most people have that, Unfortunately, we'll probably be doing the social distance and masking thing. But it's a big deal. If we continue to do the social distancing and masking thing, we can help reduce the numbers on the virus. And like I said, two things will help us get out of this. One, people building up immunity, and two, bringing those numbers down on how many people have the virus. And if we wear our masks and social distance until that number is low, then I think there is a day in 2022 or maybe late 2021 where we will be able to go once again without masks and social distancing. So that's my hope, Gia. Grayson, do I see a hand? Do you have another question?
I have one more question. Why are people getting sick even though they have they still wear a mask?
Yeah. So masks are really good at helping us to prevent our droplets, our breathing, and our spit from getting to other people. That's what it's really good at. But it's not always, and it's definitely not 100% at preventing, any particles from the air or any germs that might be on a surface or any germ that someone might touch us with from coming into our respiratory system and from breathing. So our regular masks don't block 100% of everything. Masks do a great job at, if you have the germ, coronavirus or any other germ, it does a really good job of preventing it from getting to other people. So that's really why we wear our masks, is to make sure that our other people around us aren't experiencing our germs. But they're not 100% at keeping other germs from getting to us. So the more we go out, the less we wear our mask and the more close contact we are in with people, the more likely we are to get COVID. And, sometimes people are doing those things and there's a chance to get it. So great question, Grayson. Jane, Gia, anything else that you guys are worried about or thinking about?
Oh, actually, I do have a question.
Yeah, Jane.
I was wondering about sports. They're supposed to come back as of the 21st, at least at my school. But do you think that is a good idea?
So Jane, I think the decision-making process for your school, and probably the way I would be thinking about it is, all right, let's look on the 21st, how many people have this illness. If it's really common, if we're saying that a lot of people have it, then it's probably not a good idea for us to get back close together in sporting settings. But if the numbers are low, then I think there are some sports that could be really good opportunities. Sports where you can still say reasonable distances apart. I wouldn't recommend us all getting into a big stadium together, right? Like that would be a bad idea. But there are probably some sports that would be more safe. For example, any individual sport, if you're running, if you're cross-country skiing on your own, those are really good and healthy things to be doing outside. So I don't think we should be, and one thing I'll also say, Jane, is I think it's really important that we all do some physical exercise for ourselves during this time. We're seeing a lot of kids and a lot of adults kind of sitting still a lot. And so the more we can do is a good thing. So I'm a big fan of sports and I want us to be doing physical activity. I think depending on the numbers, we'll decide whether it's a good idea to get us close together doing sports. Someone else had tossed us a question about, do we think coronavirus will be around at the beginning of the next school year? I do. I think the virus will still be around. The virus may be around for a long time in our community. But like I said, if we can build up people's immunity and we can reduce the number very low, then people will not only have less of a chance to get the illness, but they'll also get, they won't get as sick, should they get the virus. So I do think coronavirus will be around, but I also think that we're going to be, as the vaccine is rolled out and given to people, and as we take these precautions, it's going to be safer for us to be in space with other people. But stay tuned to your doctor, to your folks at home, and your health professional, your people at home, because they'll give you guidance on when we can start to do some more of these things. I think it's coming. I really do. It'll just take a little bit more time for us to give people the vaccine.